All right, welcome back to Discussions with Dr. G. I'm Dr. G, your sarcastic, slightly cat-obsessed professor and RN. And today we're diving headfirst into the world of anti-inflammatories, starting with the old faithful, NSAIDs. That's right, non-steroidal anti-inflammatory drugs. If you've ever popped an Advil after a wild weekend, or, I don't know, just tried to get out of bed after you've turned 30, you already know who these guys are. NSAIDs are kind of the everyday heroes of pharmacology. They're frontline for pain, swelling, and fever. Now, NSAIDs like aspirin, ibuprofen, or naproxen, they work by blocking the cyclooxygenase enzymes 1 and 2, otherwise known as COX-1 and COX-2. COX-1 and COX-2 are kind of like factory workers building prostaglandins, which are those mischievous molecules responsible for pain and inflammation. COX-1 protects gastric mucosa, platelet aggregation, and renal perfusion, while COX-2 mediates pain, inflammation, and fever. NSAIDs block prostaglandin production, therefore reducing pain and inflammation, but also thinning the blood and potentially causing GI upset. This means, as much as ibuprofen helps, it's notorious for irritating the stomach lining, and if you take too much, you'll meet GI bleeding, which is not a fun friend to have. Don't get me started on the kidneys. NSAIDs can really throw a wrench in their day, especially in patients with existing kidney disease. Oh, and if your patient has peptic ulcer disease or is on blood thinners, that is a flashing neon no. The maximum safe daily dosage for ibuprofen specifically is 3,200 milligrams per day. Moving on to corticosteroids. Think prednisone and dexamethasone. They're like calling in the SWAT team. These are your heavy weights. If NSAIDs are a garden hose, corticosteroids are the fire extinguisher. These work by kind of hijacking your body's normal machinery. They head straight for the cell nucleus, crank up the anti-inflammatory proteins, and throw cold water on your immune cells' party. We're talking serious anti-inflammatory and immunosuppressant action, which makes them frontline in a ton of autoimmune conditions. They basically suppress the whole inflammatory orchestra by blocking multiple steps in the immune response. They're super effective, and here's where I'm going to sound like your grandma, these can be a double-edged sword. Long-term use, we're talking fluid retention, mood swings, moon face, buffalo hump, hyperglycemia, osteoporosis, immunosuppression, and an elevated risk of infections that'll have your immune system on vacation. You've got to screen patients for their blood pressure, blood glucose, history of infection, pretty much their life's biography before tossing steroids their way. And if you have to teach your patient, teach them to taper off the steroids, or they'll run the risk of adrenal insufficiency. So basically what happens is when you're on steroids for any length of time, your adrenal glands slow cortisol production to a minimum. Cortisol is your body's naturally produced steroid. If you suddenly stop taking the prescribed steroids, you could end up in what's called an adrenal crisis, which is life-threatening. Symptoms include severe vomiting, low blood pressure, and even shock. So let's take a left turn now to something a bit spicier. Capsaicin. Yeah, the stuff that gives chili peppers their punch. But what's it doing in your medicine cabinet? Well, topical capsaicin is used for a whole bunch of pain syndromes, especially neuropathic and musculoskeletal pain, because it messes with the TRPV1 receptor on nerve endings. That basically means it distracts your nerves so they can't scream ouch as loudly. You'll see this stuff everywhere now, especially in over-the-counter applications. Creams, patches, and even some prescription formulas if you want to level up your game. Have you ever heard of Salon Paws or Aspir Cream? Side note, wash your hands after applying anything with capsaicin in it. Trust me, touching your eyes after, Not recommended. I'll spare you the gory details, but trust me, it's memorable. Alright, so let's pivot again to everyone's least favorite sparkly surprise, gout. So gout is all about uric acid crystals crashing the joint party and making movement feel like walking on broken Legos. For an acute attack, you have 3 big options: colchicine, NSAIDs, and corticosteroids. Colchicine is one of those drugs where just a little too much turns into a gastrointestinal disaster zone. We're talking nausea, vomiting, and diarrhea. You want patients to call it the first sign of trouble, not wait until their bathroom becomes their new best friend. NSAIDs are a classic pick too, again, as long as there's no GI or kidney drama brewing in the background. And the corticosteroids come in clutch if neither of those are options, but then you've got all the baggage we just talked about. For long-term prevention, that's where anti-hyperuricemics come in. These are meds that help keep uric acid in check. I need you to think allopurinol, febuxostat, and probenecid. With allopurinol and febuxostat, we block xanthine oxidase, so there's less uric acid production. Probenecid, that one helps the kidneys get rid of uric acid, so basically more is peed out, less is lurking in your toes. But here's the big red flashing warning. Hypersensitivity reactions can get serious and even life-threatening. Rashes, fevers, sometimes kidneys get involved. You gotta monitor your patients and educate like crazy on when to call for help. Now, patient stories make this real, so we're going to talk about Mr. R, who came in limping, completely fed up. He turned things around mostly by cutting out like everything delicious. Bye-bye red meat, bye-bye beer. But that, in addition to allopurinol and his uric acid levels, dropped enough to impress even the most jaded attending. Side note, major lifestyle changes plus the right drug can really be a winning combination. Here's my infamous uric acid analogy. Uric acid crystals in the joint are like sprinkles. Awesome on cupcakes, absolutely not awesome in your big toe. My apologies to sprinkles, but I didn't want them in my joints. Thank you very much. So, transitioning one last time from inflammation in general to a classic case of osteoarthritis. This is where your joints are less well-oiled door hinge and more rusty garden gate. For mild to moderate osteoarthritis, acetaminophen is still a first-line option. Why? Well, it doesn't beat up your stomach like NSAIDs do, but here's the catch. Don't let your patients start doubling up, or they'll end up starring in their own episode of acetaminophen toxicity, not just a myth. Liver toxicity risk is real, especially if someone enjoys a glass or 3 of wine daily. 4,000 milligrams or 4 grams per day is the daily maximum safe dosage. Now, topical analgesics like creams, patches, and gels. These can be great for folks who can't or shouldn't pop pills in and day out. Not as likely to burn holes in your stomach lining either. Then we've got intra-articular corticosteroids, also known as let's just inject comfort directly into the knee. Obviously, there are limits to how often you can do this because too many shots can damage the cartilage even further. But for some patients, the relief is absolutely priceless. And this brings me to one of my favorite patient stories. Mrs. J, retired ballet teacher, so picture decades of pirouettes and fancy footwork. Her knees were giving her so much trouble she barely made it from her armchair to the mailbox. After her care team optimized her meds, adding a topical NSAID gel and timing her acetaminophen just right, she started taking daily walks again. I mean, she wasn't doing grand jetés down the street, but her quality of life, major improvement. That blend of treatments gave her back some freedom without a ton of side effects. That's why we talk about individualizing therapy. Because let's face it, a retired ballerina has different priorities than, say, my cat. All right, guys, that's the whirlwind tour. We have dissected the frontline meds for inflammation, osteoarthritis, and gout, tossed in a couple of cat shenanigans, and maybe a sprinkle or two. Next time, we'll unpack more about immune pathways and what happens when the system goes crazy. So stick around. This is Dr. G signing off. Now, go pet your cat and take care of your knees.